Hey, howdy everybody, Dr. Eye Guy here. If you are new to contact lenses, then you just clicked on the right video. I just combined my videos on how to put contacts in and how to take contacts out into this one beneficial video with my tips and tricks. So be sure to wash your hands, get your contacts ready, and let's focus in. Now usually I tell my patients to use their dominant hand to actually handle the contact lenses. This is where you're going to use the pad of your pointer finger to get the contact lens out of the package. A lot of the time you can actually just dip your finger into the solution and touch the contact, and the contact will just stick to your finger, or you can scoop it out. Now you want to maneuver the contact and flip it over so it sits like a bowl on the finger you're going to use to put the contact in. This is where you're going to carefully examine the contact lens, bring it up to eye level, and there are a few things that you want to check for. Check for any lint or particles or rips or tears or chunks out of the contact, because if you put that in your eye, yeah, it's not going to feel very good. Now this is also where you want to make sure the contact lens isn't inside out. There is a correct way that it goes onto the eye. The best way to tell is to look at the top edge of the contact lens. If it's holding a firm bowl shape, then it's correct. If the edge of the contact lens is flailing out, then it's inside out. Another easy way to tell is actually to pinch it between your fingers. If you pinch it and the edge of the contact lens is pointing in, it's holding its shape, then it's correct. If you pinch it and the edge of the contact lenses are flailing out, maybe they're hugging your fingers a little bit, then it's inside out. Okay, here we go. This is where we're actually going to put the contact lens in. And this is what I usually tell patients. There are two big enemies to getting contact lenses in. Number one are your own eyelids. So I'm going to start with my right eye. The contact is in my dominant hand. My non-dominant hand is going to control my top eyelid. So you want to reach right over your head and reach down and pull that top eyelid up with your fingers. Your dominant hand, middle finger, is going to pull down on the bottom eyelid. Now here are the biggest tips I can give you to make this go fast. When you're grabbing the eyelids, you want to grab as close as possible to the eyelid margin, right near the eyelashes. If you grab too high or too low, you won't create enough room to get the contact lens onto the eyeball. If you grab to the eyelashes and pull pretty hard, that will create a lot more room to make it way easier to get the contact lens in. Now here's an even better tip, especially if you have long eyelashes. When I'm grabbing that top eyelid, I actually very slow and very gentle grab my eyelashes and pin it up against the orbital bone on the top. This will get the eyelashes out of the way, and it will really lock your top eyelid open to make it a lot easier to get that contact lens in. Okay, now that you got your eyelids locked open, here comes enemy number two, your own eyeball. Now when you start bringing that contact lens close to your eye, sometimes your eye is going to flip out a little bit. It'll start looking up, down, left, right, just to get out of the way of the contact lens. Here's my pro tip on this one. As you're approaching the eye with the contact lens, you want to try your best to keep looking at yourself in the mirror. Keep looking straight ahead. If all of a sudden you're looking at the ceiling or the wall or to the side, it's going to be really hard to get that contact lens right on the center of the eye. Now here's my tip on this part. The temptation will be, once the contact touches your eye, you're going to want to go really fast and shove it right into the eye as fast as possible. But I'm sorry to say, this will be super difficult and probably won't work. If you go too fast, the contacts won't have a chance to adhere to the eye and will a lot of times fold over back onto your finger. This is where we want to have a little bit of patience. Once the contact touches the eye, you want to push in just a little bit and give it 2 to 3 seconds. This will give the contact lens a chance to adhere right onto the cornea. The other tip here is, once you know the contact has grabbed onto your eye, the temptation will be to close your eyes really fast, but that might push out the contact back out of your eye. If you can, once the contact is on the eye, slowly and gently release your eyelids and slowly blink. This will help smooth out the contact onto your eye and help it stay in there. Also a tip for the contact lens, if you notice the inside of the contact is a little dry, try putting 1 drop of contact lens solution in the contact. That solution will help create a better suction when you're putting it on the eye. It will help that contact adhere and grab onto the eye. Another tip, if no matter what you do, the contact lens is staying on your finger and not grabbing onto your eye, try drying the tip of your finger and keeping the inside of the contact lens wet with solution. This will help the contact lens release from the finger and grab onto your eye. Okay, now that you've got the contact in one eye, you just switch over and do the same thing in the other eye. And I usually just tell people to use the same dominant hand that they used and just switch over and go through the same motions. Okay, now that you have the contacts in, hit that like button and let's take the contacts out. I usually tell people to use their non-dominant hand, reach over and grab the top eyelid and pull, and then the dominant hand using the middle finger to pull the bottom eyelid down. Now remember, you want to grab the eyelids from the eyelid margin where the eyelashes are. Now that we have the eyelids out of the way, we're going to use our pointer finger and our thumb on the dominant hand to actually take the contacts out. And this is what you need to practice. You need to be able to make a tweezer-like motion with the pads of your thumb and pointer finger. You don't want to be using your fingernails or the tips of your fingers because you could accidentally scratch or damage your eye. Now with the eyelids out of the way, you're going to take your fingers and you're going to aim for the bottom third of the cornea, the bottom third of where that contact is at. Now when you actually touch the contact, make sure both fingers are touching the contact. And then you're going to make your little tweezer motion, and that's going to grab the contact right off of your cornea. Okay, now here are the tips to make that easy. Kind of like when you put the contacts in, you want to make sure that your eyes are staring straight forward, looking at yourself in the mirror. It's going to be a lot harder if your eyes are going to be moving up and down, left and right, because it'll be really hard to actually follow and chase that contact to take it out. So make sure you're looking straight ahead so you can aim and hit your target. The other tip, and this is probably the best one, when I see a lot of people learning how to take the contacts out, the amount of pressure that you put on the eye or the contact lenses is a little bit more than you think it will be. A lot of times they'll go in and use their tweezer motion and then they pull out thinking they got the contact lens, but it's still in the eye because they didn't apply enough pressure to actually grab the contact. When you touch the contact with your fingers, push in just a little bit and then do the tweezer motion, and that will get the contact out of there. Now just be careful, don't push too hard, don't get aggressive about it. It's just a little bit more pressure than you think, and then do the tweezer motion. That will allow you to grip the contact a little bit better. A lot of people have a hard time feeling the contact lens or knowing where the contact lens is. Sometimes they'll be tweezing at their eyeball and not the contact, and actually irritating their eye even more. So this is a way to actually know where the contact is and to kind of loosen the grip the contact has on the eyeball. For this way, before you use the tweezer method, you're going to actually look up a little bit and you're going to use your finger and touch right on the eye and drag down very, very gently. Now make sure you touch right on the cornea if you can, and that light pressure, and drag down. This will drag the contact down your eyeball as well. Now this will do two things. This will loosen the grip it has on the eyeball and also give you a tactile response so you know exactly where that contact is. So let me show you this one. So you're going to look up just a little bit, use your pointer finger right on the cornea and drag down, and you'll see your vision kind of warp a little bit and you'll feel that contact get pulled down. And then once you've pulled it down, then you can go in with the tweezer method and try and grab it that way. So let me show you here. I'm going to look up, gently drag down, then go in with the tweezer method and then pull the contact right off. You can also use the same method and actually pull it to the side if that feels like it would be easier for you as well. For this one, you're going to use the same process. You're going to look off to the side instead of look up. Make sure that you use your pointer finger right on the cornea and then drag the contact over to the side, and then use the tweezer method, and then you can pull it right out. Now for people that have really long fingernails, it can be a little extra difficult to get the contacts out because it can be really hard to use the tweezer method. This way is not as popular, but sometimes it's the best way if you have really long fingernails, and that's to not even use the tweezer method. Instead, you're going to pull the contact and keep pulling, and the contact will be bunched up onto the side and roll out, and then you can grab it off from there. If you're needing additional tips and tricks, make sure you check out my playlist right there with my full videos. I'm Dr. Neil Guymon, Dr. Eye Guy. Stay focused.